do this together. While I'm counting the heart rate, I count that for 30 seconds if it's regular, and then the next 30 seconds I count the respirations, which I look at the rise and the fall of the chest, and that equals 1 breath. Generally, if you tell a patient you're going to count the respirations, they change their rate of breathing. So it's good to conglomerate those two together so you can get a more accurate reading. So what we're going to do is we're going to first count the heart rate, and to do that you can use several different sites. Typically people use the radial, which is right here, right below where the radius bone is and the groove right there. Or you can use the brachial artery, which is in the end of the arm where the antecubital fossa area is. Or you can use the carotid, but here we're going to use the radial. So what I'm going to do is I'm going to use my index finger and my middle finger. Don't use your thumb because you can feel a pulse in your thumb. So use those 2 fingers and just put it over in the groove of where the styloid process is and the radial artery. And feel that and count for 30 seconds if it's regular. If it's irregular, count for 1 minute. And a normal pulse rate in an adult is 60 to 100 beats per minute.
Okay, this is it. Let's count our respiration together. Remember, okay, remember. Sorry, remember. When do you count the respiratory rate of your patients? When do you count it?
From here, ma'am. 10 to...
No, when? When do you count it? Remember, I shared with you earlier, diba? When we are measuring, the respiratory rate, we do not tell the patient, "Ma'am, sir, I will now count your respiratory rate," right? So, anong gagawin niyo? When you are doing your pulse rate, it's either you count the respiratory rate first of the patient, or you do the pulse rate, but do not remove your 2 fingers there, and then discreetly look at the patient and count the respiratory rate. Right? Yeah, because if you tell him or her, what will happen? Yeah, okay? Good. I will observe that in your written demonstration. Okay? So, this way, you are performing your non-verbal communication skill. Okay? Okay, let's continue with this first demo. Sorry.
Everyone, and I am your nurse, and I'm going to be giving you a vibe in the ear, or you can take it temporal probe. And hold it there until it beeps. A normal temperature is about 97. That is the reading on the top. It's read as SpO2. And then on the bottom, you will see his heart rate, which is 64. But here in a second, I'm going to show you how to actually count the heart rate using the radial artery. Okay, now we are